I'm often asked the question, what is cognitive behavioral play therapy? And the answer is, first and foremost, that it's a theoretical approach to psychotherapy with young children. Typically, we're talking about 3 to 8-year-olds being in the kind of perfect range for this approach. Cognitive behavioral play therapy incorporates cognitive behavioral therapy as it's used with adults into play therapy, and the CBT, or cognitive behavioral therapy, provides the framework for the play therapy and the theory. It's based on the cognitive behavioral principles of therapy, and it integrates those in a developmentally sensitive way. So both verbal and play therapy approaches are used, and the play is really important for the younger children since many of them have not developed their verbal skills are not as well developed. It definitely uses a problem-solving approach, and it really tries to help children with what I would like to think of as their maladaptive thoughts and behaviors. In cognitive behavioral therapy, we frequently think about irrational thoughts. Many times for kids, those thoughts are not irrational because they don't have the learned history to understand why they're irrational, so they're maladaptive. And the adults in their environment understand that they're irrational, but the kids don't always understand that. Previously, we really thought kids were too young to be able to participate in any kind of cognitive therapy, and that's where this approach comes in, where we use the cognitive behavioral play therapy effectively as long as we can adapt it to the child's developmental level and the child's needs. So we're communicating indirectly through play, and very, very frequently using modeling, which is one of the best ways that we can communicate cognitive behavioral approaches through play therapy and the integration of those in the CBPT approach.